This segment of DelmarvaLife is brought to you by Peninsula Regional Medical Center.
While some people may feel uncomfortable after overeating at a large meal, for others it happens every single day, often after every meal. It's chronic acid reflux, but now there's a breakthrough treatment. Unfortunately, some patients are battling insurance to get to it. Only in his mid-20s, Jarvis Harry has been suffering from a chronic illness for years.
Lump sensation in the back of the throat, constantly having to clear my throat.
Like 40 million Americans, Jarvis has GERD. Not just heartburn, but chronic acid reflux. The muscle between the esophagus, the tube that carries food, and the stomach becomes weak, allowing digesting food and stomach acid to come back up.
It sometimes affects my professional career as a speech therapist. Sometimes the vocal hoarseness, vocal cords are inflamed.
It seems to be more common in overweight men, and that can be more of a at-risk population for esophageal cancer.
Several family members have GERD. His grandmother died from its complications. A 2-day test showed acid reflux 163 times. Along with the risk for cancer, trouble sleeping, and chronic discomfort, doctors now know there can be substantial side effects from being on acid suppression medications long term. So surgeon Dr. Jimmy Redmond wants Jarvis to be the second patient in the state to receive the new implant for GERD.
We finally have 5-year results that are showing that about 93% of people are off their medicines and are happy with their procedure.
This mini bracelet of magnets is the only FDA-approved implant device for GERD. Through laparoscopic surgery with tiny incisions, it's tied around that weak muscle at the opening to the stomach. The outpatient surgery only takes 20 minutes under anesthesia, and people can eat solid food right away. The scan shows food going through the esophagus into the stomach. For steak, several magnets separate, then close. For water, only a few.
And what's amazing is in the recovery room, your reflux is gone.
As of right now, Medicare does pay for the lifelong implantable device, but private insurance companies have been denying it. Now doctors have been appealing it on a case-by-case basis, and with long-term studies now showing its effectiveness, they're hoping the insurance companies will come around. As for Jarvis, insurance denied him the implant more than 2 months ago. Now, he's lost 10 pounds in 2 weeks from the nausea.
I could have the procedure on a Friday, return to work the following Monday.
Jarvis wants to be like Dr. Redmond's first implant patient.
He felt an automatic, instant shut-off of his reflux. And he's been eating hamburgers and steaks.
By the way, the price of this implant is a little over $12,000 without insurance. Now let's delve into what exactly is chronic acid reflux. Jimmy, you have more on that.
Yeah, well, Lisa, as a matter of fact, that procedure is still experimental, and there's a lot of people that wonder, well, what is acid reflux? That's why joining us today from PRMC is gastroenterologist Dr. Dan Daniels. Thank you for coming in today.
Thank you.
So help me out here. Describe exactly what is acid reflux?
Acid reflux is, first of all, acid is a normal fluid that's contained in our stomach, and it's stimulated, and the acid production is increased after a meal. When acid is regurgitated into the esophagus from the stomach, the esophagus is not able to tolerate that high acid level. As a result, you have this burning sensation and sometimes even a sense of regurgitation of fluid coming up in the back of your esophagus and your throat. That's basically what acid reflux is.
It seems like we're hearing about it all the time now. Is it being diagnosed more frequently, or is it happening more often? What's going on here?
The incidence is increasing, and it is because one is because of dietary indiscretion. We're eating more fatty and greasy food, which facilitates more reflux symptoms. We're getting more of overweightness, and that increases the risk of reflux as well. And then other habits such as smoking does increase the reflux. Consumption of alcohol increases symptoms of reflux. So there are.
Right. I fight with it a little bit myself. Is there any way that I can determine whether or not it's acid reflux or just indigestion?
Indigestion is a little bit of more of a general term, which implies an ingestion of food, and then somebody is not tolerating the food that's being ingested. And it could manifest itself as regurgitating, acid reflux, burning symptoms, or just fullness after you eat, bloating, and the sensation of the food that you have just eaten is not just agreeing with you.
Right.
Acid reflux is very specific in the fact that you have to have sort of a burning sensation, and you have to feel that regurgitation of sort of like an acid or water brush coming up in the back of your esophagus all the way up to the throat. Now there's a little caveat, there are silent refluxers, which is a little bit different than the true acid refluxers.
So if we have the condition, what should we do?
Well, the first is you adjust your diet, your eating habits. You do not eat and recline at least a couple hours, avoiding mostly greasy and fatty food late in the evenings, because that decreases the pressure of the lower esophagus, which controls the acid from regurgitating up. Lifestyle modifications, a little bit of weight loss would also help.
So just between us girls, I'll admit that I usually try to tough it out and just, ignore it, but that's not the best thing to do, is it?
Once you modify these things and you are not responding to this modification or lifestyle changes,
right.
Then antacids are good, late in the evenings. They neutralize the acid, but they don't do anything for the reflux part. And then you'll get into the prescription medications, and even over the counter now there are many good and powerful medications.
Could this lead to something worse?
Yeah, it does, actually. That's why you have to, the rule of thumb is if you're 50 years old, you have reflux for 5 years, you need to be evaluated.
Okay.
Because your risk of developing other disorders increases, such as stricture of the esophagus, and even the dreadful diagnosis of Barrett's esophagus, which increases the risk of developing esophageal cancer.
And that's a whole other story in and of itself, isn't it?
Yes, it is.
My goodness. Dr. Daniels, thank you so much for your time this afternoon and explaining all of this. If you'd like to know more about what Dr. Daniels just had to say, all you have to do is go to our website, wboc.com, and click on a picture at the top of the page. Now, Lisa, you've got more about Barrett's esophagus.
That's right, Jimmy. After years of suffering with the disorder with seemingly no long-term cure in sight, one woman has been introduced to the latest in technology. It's a quick procedure that is able to help her live a happier life. Severe acid reflux is what started all the trouble for Pam Sinclair. In 2006, she was diagnosed with Barrett's esophagus. The lining of her esophagus changed from healthy light pink to red. It's a condition that put her at a greater risk for deadly esophageal cancer.
Anything when you see cancer, it scares me to death.
Pam turned to the experts for a new therapy. Gastroenterologist Dr. Sandeep Patel is the man using the controls of the Barretts Halo 360 system. It uses radio frequency energy to burn off a thin layer of cells.
What we essentially do is burn the most superficial layer of the esophagus so that the normal underlying lining, what we call mucosa, can grow back in its place.
Using a tube down the patient's throat, the doctor inflates a balloon that presses against the sides of the esophagus. 5-second bursts of energy destroy the diseased tissue. The outpatient procedure takes about half an hour, and recovery is simple. New, healthy cells grow back in a matter of weeks.
It's been amazing. So I'm hopeful that in 8 weeks when I go back in and get checked that all the cells are healthy and the precancer is gone.
I think this will change our complete algorithm in terms of how we take care of people who have Barrett's esophagus.
Doctors urge you to get checked if you're experiencing pain. Don't simply pass it off as indigestion. Barrett's esophagus is a potentially cancerous condition and is best treated when caught early. Well, things that are vital to catch are the hidden stories of those in our community, those who make Delmarva home, much like the man of the chicken industry here on Delmarva, Mr. Frank Perdue. Still ahead, we sit down with his wife, Mitzi, who tells us all about their life together, as well as how she's allowing his legacy to live on. Well, one legacy certainly living on is that of the Nuestra Senora de Atocha. In fact, Mr. Perdue had something to do with it. Hear why many valuable treasures from the sunken ship call Delmarva home. Plus, Maryland is his home. After the break, we hear what Governor-elect Larry Hogan has in store for the Old Line State from WBOC's very own Paul Butler. But first, moments ago, we learned about chronic acid reflux. Dr. Oz has more on who can help you treat it.
Hi, I'm Dr. Oz. What do hearing problems, sinusitis, and acid reflux all have in common? They can all be treated by an ear, nose, and throat specialist, also called an ENT. ENTs are trained to treat problems like chronic nosebleeds and laryngitis, as well as balance disorders and dizziness. Ask your primary care doc if you can benefit from seeing an ENT.